So, hi, Raj, how are you?
I'm doing well. Thanks for coming back. We missed you. The audience also missed you.
So, I missed Sharetrick HIV too, and I know it's been a long time, and I'm very happy to be back.
Thanks, thanks,
Back
thanks.
home, I can say.
Yes. So,
So
you know,
I was traveling actually, and that's how there was a. My daughter went back to her studies. She's gone to Paris, and she's completing her studies there. And it was like an empty nest syndrome kind of a thing. And then we planned a quick trip within India to Kodaikanal, and I'm back now, all refreshed
nice.
and ready to do our
Travel,
videos once again.
travel always is rewarding, and it changes your perspective, gives you a fresh start. I think when we end this video, maybe you could share a little bit about, you know, how travel helped you overcome the feeling of a bit of a loss because your daughter has gone off abroad to
Yes.
study, and you're not going to see her for another 6 months or 8 months or 1 year, whatever the duration is, and how you use travel as a tool to kind of recenter yourself and get on with your life, right? It will be very interesting. I guess our audience might like it. So
I will surely share a very beautiful experience that I had during this travel, for sure.
uh,
But now let's come back to our subject. And Raj, today, the question that I'm going to ask you is, we already had a short discussion on that, but for the sake of our wonderful audience here, what is 10-1074 all about?
yeah, so I want to give a bit of a context as well because I did some videos when you were away, Maha, and so this will
Yeah.
bring you also up to speed. We just spoke
Hmm.
about 1074 before this Zoom recording, so that
Yeah.
we could understand how we wanted to do this video. But to the audience, I'm going to share a screen out here and show to our audience what it is that we are talking about. So here we are. Um, in this slide, you would see that this section out here is the HIV virus. It has got blue colored areas, green colored areas, red, purple. These are different colored areas. These are all highly conserved areas of HIV, which is very, very important for HIV in order to survive. And therefore, these are the areas that can be targeted. So a long time ago, scientists were looking at the blood of chronically infected HIV patients who had suffered a lot, and in their blood they found a kind of antibody that was in general able to latch on to the mutating antigen in each of these regions of HIV. So they called it as broadly neutralizing antibody. And 10-1074 is one of the broadly neutralizing antibodies that we're going to discuss today. But in this series, I actually started by talking about PGDM 1400. I have completed VRC07. We have completed PGT 121, which is also another broadly neutralizing antibody, which goes to the V3 supersite. And today, we are going to talk about 10-1074-LS. So the actual broadly neutralizing antibody was 10-1074. LS stands for long acting because the scientists have done some modification so that its half-life is much longer than what it would be in its original form, which was 10-1074. So 10-1074 is a highly somatically highly mutated broadly neutralizing antibody targeting the V3 glycan supersite on the HIV envelope, which is this blue area we are talking about. It's among the most potent anti-HIV HIV-1 neutralizing antibodies isolated to date. And by binding to this specific site, it inactivates the virus and prevents cellular infection. So that's what 10-1074-LS is all about.
And which brings us to the next question, and that is, which specific part of the HIV virus does 10-1074 target actually?
Yes, so it targets the V3 glycan supersite of the HIV-1 envelope protein. This site is crucial for the virus's ability to infect the cells, and by binding to it, 10-1074 can neutralize the virus. So when the virus goes and binds onto that site is now not able to interact with anything on the CD4 T cell. So even if it is attracted towards a CD4 T cell, it cannot work on that. It's like a prophylactic, which prevents the contact between HIV and the CD4 T cell by coming in between the two of them. So you can think of it like if you have an electric cable which has been cut in two, when you join them, there will be sparks. But if on
Yes.
one side you put insulation tape and then bring the two wires together, there will be no spark because the insulation tape prevents the electricity from going from one to the other. So this 10-1074 can be imagined as an insulation tape on the V3 side so that the V3 side cannot interact with HIV.
Very well explained, Raj. The,
Thanks.
the analogy was, I mean, I could practically visualize it.
Yeah.
So, why is the V3 glycan supersite an important target for HIV treatment?
Yeah, because as I said, there are many highly conserved regions of HIV because HIV is a complicated virus and its life cycle involves many regions of the virus that need to perform a particular task. And because our CD4 cells do not mutate as the HIV virus does, there are a lot of common parts on the CD4 T cell which do not mutate and the HIV uses it, like CCR5, like CXCR4 and like the CD4 receptor. These are all common parts of CD4 T cell which do not mutate much. They remain as it is. And therefore, the HIV is in a way constrained that if it mutates any part of its body, its components, which are used to negotiate with the CD4 receptor or CCR5 receptor or CXCR4 receptor, or after getting into the HIV virus, if the reverse transcriptase or all of those kind of components are interrupted, then that version of HIV cannot progress further. So that version of HIV will die. But since HIV is mutating in the body, the other versions of HIV, where those conserved areas are slightly different and still viable, will continue to infect the patient. And therefore, any modification in these conserved areas, which are not viable, will be removed from the live stream. And the ones that are uh, correct, they will continue to progress. Another example I can give for you would be that let us take the case of animals in the forest. When
Mm.
a when a deer is born, it has to get up and it has to start running with its mother. Any deer
Yeah.
which is not able to run will be eaten by a predator. As a result of which, the natural selection makes sure that all the deer that are born are able to stand up as soon as they are born, and they are able to run with their mom as soon as they are born. And therefore, the predator has now got to become even better. So the lions and tigers become that much more agile. So this natural battle happens in real life, and in our body also the same battle is happening because the HIV virus keeps on mutating. It's outside
Okay.
its control, and only those versions which can continue to exploit the CD4 T cell and its components will continue to persist. And that's the reason why the V3 glycan super area is very
Mm.
important. And that's why it is being targeted by BnAB's.
Super. And when did the clinical trials for 10-1074 begin?
Yeah, this is common question that is asked by most viewers whenever I
Yeah.
do any new therapy or any new BnAB. But I have not been able to get a definitive answer, but it's somewhere between 2015 and 2016 when the phase 1 trials got started. I don't know about phase 2. I couldn't get any information as such.
Okay. So just it's we just know about the phase 1. That's it. Any further
Phase 1, I
progress
have
we are not
more,
aware of.
yeah, more definitive information that it started somewhere around 2015 and 2016.
Okay. And although you just briefly mentioned it,
Yeah.
what exactly is 10-1074 LS?
Yeah. So LS seems to be something to do with the lifespan of the antibody, broadly neutralizing antibody within our bodies.
Yeah.
Because the most important thing is that when you put a HIV fighting agent into the body, or for that matter, if you give a vaccine to somebody, the question you ask is how long is it going to last in the body and continue its fighting? So 10-1074 would degrade much faster as compared to 10-1074-LS. Now I'm going to
Yes.
show you the graphic again of what we were discussing before. Now in this, you can see the various antibodies that we are talking about. So you
Yeah.
got 10-1074-LS, and you'll also
Mm.
find the last two words, alphabets LS here,
Yeah.
10E8V. So 10E8V is the original BnAB. It has been modified to last longer in the body. That's why the suffix LX is added here. Same way you'll
Mm.
see 3BNC117-LS. So LS is the modified version which enables that BnAB to last longer in the body. Same way for
Okay.
VRC01-LS. So VRC01 was the original, and LS is the longer lasting form, which stays in the body for a longer period of time. So that's how I would explain it.
Wonderful. So, what exactly is the target for both this 10-1074 and 1074 LS?
Yeah, so I would say that the target is basically to make sure that we have another way of holding back HIV. Now, Gilead Sciences is developing, because the next thing you would ask me is which company is developing it.
Yes,
So it's
yes.
Gilead Sciences which is developing it, but their target basically is to have something that can inhibit HIV. Now, the question is, what is 1074 LS going to um, target? It's targeting the V3 glycan supersite on the HIV envelope spike protein, and it could act both as a preventative measure, as well as it could act as something that can be given to someone who already has HIV. Because if it's going to target the V3, and if it is still not inside the body replicating itself, that means we are talking about a limited number of HIV that has just entered the body. Probably 10-1074-LS can work. But typically, monotherapy has not been successful with HIV because HIV mutates, and it will mutate out the, the antigen for which
Mm.
the antibody or the BnAB was designed, and it will create other antigens which will do the same job. So that's the reason why 10-1074-LS will always be tested with other ART. So that's the way I would answer that.
Which brings us to the next obvious question. What are the results of the phase 1 trials?
Okay, so for 10-1074, phase 1 trials were involving 33 subjects. That's what I have understood. And it was a single intravenous infusion of 10-1074, which was well tolerated. The estimated half-life was 24.0 days in uninfected subjects and 12.8 days in HIV-1 infected subjects, which means for uninfected subjects, what happens is it has not, the HIV has come into the body, but it has not started replicating. It's looking for CD4 T
Mm.
cells to get into. And therefore, it is much easier for 10-1074 to attack it and take it off. But if it's already infected the people and it's replicating inside, then it won't. The HIV would modify and mutate itself so that not much of it gets produced, and therefore the uh, BnAB will just degrade and die because it's not being used. So among 13 viremic subjects receiving the highest dose of 30 milligrams per kg, 11 showed a rapid decline of viremia by a mean of 1.5 to log 10 copies per ml. However, multiple independent 10-1074 resistant viruses emerged within the first week after infusion. So this shows the futility of a monotherapy. But in phase 1 trial, they were
Mm.
looking at 10-1074 to make sure that by itself it's not causing any harm, because phase 1 is always about safety. Phase 2 is
Mm.
for dosage and effectiveness. So it cleared phase 1. That's how I would
Oh,
reply
oh,
that question.
oh. So, very well explained, Raj. Um, what modifications have been made to improve the stability of 10-1074?
Yeah, so in my previous answer also, I used a term called log and all that. So many things
Yeah.
I myself do not understand. I try to keep it simplified. In this case, I would say that my understanding is that scientists have identified some weak points in 10-1074 antibodies and made changes to them to make it more stable so that it doesn't disintegrate quickly.
Mm.
The key modification included replacing certain amino acids to form a new salt bridge and making additional changes to increase its conformational stability. These changes help the antibody to maintain its structure and function better under various conditions within the human body. And they have found that it lasts in the human body for a much longer time, which means that it has more opportunities to encounter HIV and do its thing.
So, any pharmacokinetic benefits because of the modifications made to 10-1074?
Yeah. So as I said, the modifications made to 10-1074 results in increased stability, which translates to better pharmacokinetics. This means that the drug can last longer in the body, reducing the need for frequent dosing and improving its overall effectiveness in treatment. So that's what it does.
And now that we know that phase 1 trials are already done for this 10-1074, so what are the safety findings as such?
Yeah. So phase one trials found that it was well tolerated by participants. It had a half-life of 24 days in uninfected individuals and 12.8 days in HIV infected individuals. This suggests that the drug remains active in the body for a significant period of time, which is beneficial for its therapeutic use. No adverse effects were seen.
Okay. And any challenges with the trials as such?
Yeah, the reports say that there was a challenge that was identified, that was the emergence of 10-1074 resistant viruses within weeks of infusion in some participants. This resistance highlights the need for combination therapy to prevent virus from adapting and escaping treatment. So the lesson learned is that you can't just use 10-1074-LS as a monotherapy. It has to go with something else so that together they try to constrain the mutations that happen in HIV so that 10-1074-LS is not completely eliminated
Mm.
from the HIV battle.
And now that we know, okay, 10-10074 and 10-10074 LS, how do they differ? How do you differentiate them in terms of stability?
Yeah, so the only thing I can say based on my limited understanding, like if I was a scientist, I could
Mm.
probably go into details because they know the nuts and bolts of the thing. But because I do not have my own knowledge of biology, I'm not a biology major, I'm a commerce
Mm.
and management guy. So I'm trying to learn this. So what I understand is that 10-1074 LS has been designed with modification that enhances stability, such as changes to its amino acid structure that prevent it from breaking down or clumping together. So if it doesn't change shape, the way I talk about antigen and antibodies, that antigen is like a pen and antibody is like the cap for the
Yeah.
pen. So if the cap for the pen changes its shape, then it won't fit the pen any longer. Now, in
Mm.
case of HIV, we have an antigen which keeps on mutating, and broadly neutralizing antibody is a broad structure which will continue to fit on it and prevent it from infecting the body cells. So now the modification they have done to 10-1074 in order to create 10-1074 LS is to make sure that the shape of 10-1074 does not change too much. And in order to
Mm.
prevent the shape from changing too much, they identified some weak areas and they
Mm.
changed those weak areas by putting a different component in there so that it can still remain strong. So one of the
Okay.
examples I would give is that in India,
Mm.
at least when I used to live in India 30 years ago, what people used to do was they had the shoes were expensive. People will use the shoes and then the
Mm.
shoes get worn. The sole of the shoes get worn out. Some people would buy new shoes because they had money. Other people would go to the local cobbler. The cobbler, what he used to do was he used to take these airplane tires, which are um, removed after every 10 flights or 15 flights because there's wear and tear. It's a very strong rubber material.
Oh, I didn't know that.
Yeah, so they cut the sole out of that and they put it on the shoes. So the shoe has a new lease of life, right? So what they have
Yes.
done is they have reinforced the part of the shoe uh,
Hmm.
that was weaker so that it could stay in use for longer, because the uppers were always good because they were polished regularly and they did not, you know, brush with the road and get worn out. So something similar was done to 10-1074. They identified the weaker parts and they changed that with replacements which are more stable. Therefore, the shape of 10-1074-LS remains the same and it
Hmm.
continues to work on the HIV-1 strain for a longer period of time.
And one more question was whether either 10-10074 or 10-10074 LS would it be used in isolation alone, or whether it would be used in combination with other drugs?
It has to be used in combination. Very early in our fight against HIV, scientists
Hmm.
had found that monotherapies have got no chance against HIV.
Mhm.
Monotherapies will continue to work for other people, but
Hmm.
if in a given patient, if you use monotherapy, the strain of HIV in their body
Hmm.
will not be able to multiply
Hmm.
HIV viruses which have got antigen that match the
Ye-
BnAB. So
Okay.
that part of mutation will be killed, which
Hmm.
it will not be viable, it will not be able to multiply anymore. But only those
Mhm.
copies of HIV in that person's body which do not have that particular antigen is
Hmm.
going to be able to successfully replicate in the body. As a result of which, for that particular patient, that BNAB will become totally useless because their HIV has isolated and modified that antigen which was being targeted by that BnAB. So, in order to prevent this from happening, they have to use multiple components like combined ART, combined
Hmm.
antiretroviral therapy, so that
Hmm.
the ability of the virus to mutate is limited, because if it mutates any part, there are other components which are trying to prevent it. So a whole lot
Correct.
of HIV virus will become unviable, but they will become
Hmm.
unviable not because of 10-1074-LS, but because there are other ART components also inhibiting various other conserved areas of HIV.
Hmm.
So as a result of which those mutations will not phase out 10-1074-LS. So to summarize your answer, it has to be combination therapy or else it will become
I got it.
useless. Yeah.
Okay. Now that's something you keep saying, that whatever
Yeah.
new invention is there, the ART has to continue.
Yes.
So I see that in your comments as well.
Yes. Yes.
So yes.
Yeah.
And I mean, I'm sure you spoke about it earlier also. There is no mention of the phase 2 clinical trials as yet.
Yes, I don't have much details about it, but it's likely that phase two trials began 2018 or later. So
Hmm.
I don't have much information at this stage, but at a future date,
Hmm.
I will come back with more information about it. But I was very keen that I finish off 10-1074 LS with all the information I have right now instead of
Hmm.
waiting until later. And my objective, basically, for our audience, is to take them through this entire cycle of all the antibody BnABs that we have so far,
Hmm.
and just bring it all together at the end of this series and
Hmm.
show how they all fit together, because I want our audience to understand,
Hmm.
especially those audience who are despondent and saying that, oh, HIV has been around for decades, the pharmaceutical
Hmm.
companies want to make money, they don't want to solve the problem, all those things.
Hmm.
I want them to understand how difficult this virus is because of the way it mutates, and because of the
Correct.
way it is mutating. uh, it's been a challenge, but it's not due to lack of efforts by scientists. And when
Hmm.
we talk about BNAB, this is just one of the many ways in which HIV scientists have been trying to defeat HIV. There is
Hmm.
genetic interventions like AGT103, EBT101. There is reverse transcriptase. There is transcription inhibitors. So many other efforts that have been taken,
Correct.
and you look at the range of BNABs that the scientists have discovered and then try to extend the life of them. And
Hmm.
other thing I want our audience to remember is that For those who are saying companies are making money out of HIV, I would say look at people like Jeff Galvin who have put their retirement funds into developing AGT103. Right now, Jeff is struggling to find funding for phase 2, and no investor is willing to put money because high interest rates. People want
Correct.
returns for their money. Even people who are complaining about this, they are investing money in mutual funds. And if the mutual funds don't give return, they won't put money there. They won't put
Correct.
money in stocks which do not give dividend. So same thing is happening here. But there are a lot of people who are pumping money into HIV research despite all this. Look at the case of Jeff Galvin. He took it as a personal challenge. Jeff doesn't suffer HIV.
He's an amazing guy.
Yeah, he doesn't have any family member suffering from HIV. He's doing this as a challenge and he wants to come up with a cure, right? Excision Bio, Kemal Khalili, who's the guy who's running it. He's doing it for knowledge. He's doing it for the challenge of solving this problem. And he's also putting his own time, efforts, and money. He's writing grant papers. People are putting grant money into it. They're doing all those things. And Gilead and other companies, you think that they are going to make tons of money. That's not the case. They get a bad rap. But in my personal opinion, as soon as they come up with any kind of cure, WHO, the various governments, and everybody is breathing down their necks saying that, give it to poorer countries. We want to give it to poorer people who cannot afford. So when we have an environment like that, people who want to make money are hesitant to put money into ventures like Jeff Galvin's venture and Excision Bio and other places.
It is the height of selflessness, I would say.
Yeah, that is one of the
But
things.
yeah,
But again, the challenge that people watching this video should know is that investors are afraid to put money in these HIV companies exactly because of the hue and cry being made by non-profit organization and others, forcing these companies to give all research immediately to subsidized medicine. In which case, what will happen is people who are taking a high risk because HIV cure has evaded for 4 or 5 decades. So people
absolutely.
know that their money is potentially going down the drain, but they're putting it in here. And then what you're saying is, yes, if you succeed and if there is a cure, you have to give it for literally free because there are millions of people who are suffering. Now, look at it from the investor's perspective. The investors will put money in artificial intelligence, where if you put $10 now, you're getting $100 within 2 years. Fast multiplications. So
Correct.
who is going to put money in HIV research? And that's the problem for all the HIV research company at this point of time. They are doing a great job. They're trying their best. But if they don't get money, how
Raj,
can...
any idea how many research companies are involved at present in HIV research?
There are a
And
whole lot of people. Gilead has done so much for HIV. You won't believe. There's another is Vive Healthcare. It's doing
okay.
a lot of work on HIV. All of these two companies have given tons of HIV ART components because those are the things that are working. And they also
You
given
spoke about a Hong Kong company as well, right? I don't
yeah,
remember which
there
one.
are
Yeah.
companies. Hookipa is one company out there. I think it's Korean. There is it was what ACT22 with chidamide
Mm.
that's being done in Asia. So there are various companies which are doing a lot of research, but it's a question of returns. Without returns, investors won't put their money. Right now, artificial intelligence is very hot. And I myself removed money out of CRISPR Therapeutics and put it into AI because it's
Mm.
multiplying faster. So I took profits out of CRISPR Therapeutics, which did the sickle cell disease therapy, and put money into the other. Now, when I took out money, I sold 100 CRISPR shares at a profit. But now I have a lot of money invested in AI and I have profits which are more
Yeah.
than twice what I took out of CRISPR. So many people who were going to invest in HIV therapies are now investing in artificial intelligence because that's where the money is. So I want our viewers to understand that companies like AGT 103, EBT 101, Gilead, Weave, these people are all putting money in order to take care of the sector and solve the problem, despite the fact that if they put the money elsewhere, they will get a whole lot of returns more. So that's the message.
And you wanted to hear one of my travel stories, right?
Yes, yes.
So let our viewers also kind of get some
Yeah,
kind of
yeah. Please share your
motivation because of that.
experience so
Yeah,
that
yeah.
maybe they find something they can relate to.
Yes. So for me, I have traveled mostly in India. There are only two countries that I visited abroad, and that's Dubai and one more was Thailand. Other than these two countries, I've not gone anywhere, and I feel that there is India is beautiful, my country. And this time we visited Kodaikanal,
Oh,
uh,
it's in the south of India, if I'm not mistaken.
the south of India. Beautiful hill station. It's called the Princess of Hill Stations or something like that. Very close to Ooty, also Coimbatore and all that. So the thing is, we were having dinner. Chris, my husband, and me were having dinner, and there was this lovely couple on the adjacent table, and they got talking to us, and they just I was searching for a spoon. When there is a buffet, it's very difficult to find a spoon sometimes. It's hidden amongst various
Yeah.
other things, right?
Yeah.
So this couple, they said, it's just beside this particular soup counter or something like that. I was very happy. They went out of their way, and then we got talking, and I came to know that they are from Chennai.
Huh.
Uh, and there was mehendi on their hands, mehendi, the henna that
Yeah.
we call. So we South Indians have a very typical way of putting the mehendi, which is just a big round, a
Yes.
blob, and
And then on the
small,
fingers. Yeah.
smaller rounds. And the guy and the lady, both of them had that mehendi. Very surprising for the man also too. Then I said, what was the occasion? You had some kind of a celebration at home? So they said, we had our 25th wedding anniversary,
Oh,
and we got married in 99, and we've come back here to revisit our
wow.
the honeymoon days.
Nice.
And I have not seen such a loving couple in quite a while now. You know, the way she was telling very humorously about, now he is telling, okay, I know you like sweets. Okay, come on, tell me which one you want, and this and that. He was getting things for her.
Yeah.
And she was sitting here and she was very humorously remarking, you know what? I don't mind him bringing things for me, but he's got butterfingers.
He
That
drops.
camaraderie was something beautiful to watch. Uh,
Yeah.
so we got talking, and the openness with which they spoke. Perhaps it's the age that, okay, when you're in your 50s, now both of them were well past their 50s.
Yeah.
The openness with which both of them spoke struck me as something very awesome. Now, you wouldn't, now if Raj, I were to meet you for the very first time, I wouldn't open up about my health issues, right? A very big issue. Now, this lady, we were just talking, there is a beautiful lake in Kodaikanal, which is a good 3-4 kilometers. And when I
Yeah.
say 3-4 kilometers, it's an uphill.
Yeah.
So I said, Chris and I, we just walked up. We went to the lake and we came back, and we are bone tired now. We are
Yeah.
terribly tired.
Yeah.
So I said, you must go. Why don't you just visit that spot? It's beautiful. It's a lovely walk. This lady, very openly and very frankly, she said, I've got just one kidney, so I have to be very careful.
Oh, wow. So she has made peace with the fact that she has just one kidney and she
Yes,
loves her life and she's enjoying her life as it is. So she says, I have constraints, but within these
yes,
constraints, I'm going to enjoy.
I'm going to enjoy. I'm very, very open about it. And
Yeah.
there were no, bolte na gile shikwe, no kind of this thing, why
Regrets.
me and that kind of a thing.
Yeah.
So that struck me
Self-pity
as
and
very beautiful.
regrets. Yeah.
And she had, I couldn't hide this thing. It's not every day that someone tells you that I have just one kid. So I was a little struck, and she saw the expression, and then she's smiling and she's telling me, I was born with one kidney. The next sentence. And the guy, I saw that the love between them was something that I'm going to remember for a very long time.
Yeah.
And not only that, she said, I said, okay, bye. You're having your anniversary, this thing and all that. So did you have celebrations at home? Did you kind of have a party and all that? She said, no. You know what? My sister-in-law is suffering from breast cancer.
Oh. Oh.
I was struck by the openness with which they are talking about things which are very personal to them.
Right.
And so she said, she is undergoing her chemotherapy,
Yeah.
and she's just had a breast removed. And
Ah,
we are all a joint family. We are all living together. The brothers,
right.
all
Right.
the brothers, the four brothers are living in a huge house. We're all together. And she says, I can't celebrate when she is undergoing all this. So we
Right.
are just waiting for her to finish her chemotherapy and we are going to have a grand celebration.
Nice.
So Raj, there were so many things that I saw in this small interaction. The one was the husband and wife love. I mean, love can be expressed in so many ways, but this kind of a banter and things like that, I was seeing it after a very long time. And
Yeah,
then
it's
this
very
lady,
interesting. Yeah.
I
Yeah,
was,
some people, I mean, we are all born in the same family, but siblings turn different. So one is very fortunate once they have a good spouse. That's one. Second thing is if they have a family that is understanding and they get along well with them. I mean, your
mm,
life is made. We are here for just a period of maybe 90 years or 100 years if we are lucky.
mm,
So when you look at it from that perspective, then all these small things that we fight about, like property, money, geography, this and that, it all seems insignificant because we have a small period of time. We came with nothing, we're going to go with nothing. Might as well enjoy. We are like a, tourist visiting the
yes.
planet. Enjoy
uh,
and go and be happy. Make everybody happy. That's it.
I tell you what, Raj, actually, without being preachy, without, nowadays we get so many quotes, be like this,
Yeah.
be like that, and this and
Yeah.
that. Without being preachy, they taught me so many things that day.
Yes.
I really love that couple, I must tell you. So
Right.
travel gives you those kind of experiences.
Right. Right.
I cherish those things.
Yeah.
Every time you travel, you have a very interesting situation or you meet someone interesting. I think we all of us, as far as we can, try and travel within our country and get those experiences.
Yes, so I would suggest to all our audience, right? When you feel you're in a rut, when you feel a little bit down or something, maybe consider going on a trip. India is a beautiful country. You can go to Kashmir in the north and all the way up to Cochin, and in between there are so many different hill stations. There are in Kutch, you have got really good terrain, and there's the Run of Kutch festival, and so on and so forth. So enjoy something, and maybe international audience also. There are a lot of countries where you can just pick up your passport and go. Just go for a change of scene, or within your country, discover the best places that you can go to. Have a change of scene, have a broader outlook of life. So Mahat, thanks for that. Thanks for that insight.
Thank you. And Raj, before we end,
Yeah.
for our audience, I would like to talk about another experience, which is very thrilling and spectacular, but more on that in our next video.
Okay.
I'm very keen on sharing.
Definitely. So what am I going to do next? Well, in the next
Yes,
video, I'm just going to talk about another BnAB. I'm going to share the screen with you. And as you can see here, we have done a PGDM 1400, VRC07, PGT 121, 10-1074-LS. The next one is GS9722. Now that's what I'm going to talk about in the next video.
sure. Looking forward, Raj.
Thank you so much, Maha. Thanks for coming
Thank you,
back.
Raj.
Thanks for comparing this video and helping me bring the information to our audience. And a big thanks to all our audience. We have grown in number. We have crossed our 15,000 and we are marching towards 20,000 subscribers. And we have our Zoom meeting coming up on 13th of this month. And I hope all our members and Patreons will join us, and we'll have a good discussion of all the therapies that we spoke about since our last Zoom call. So that's about it. So guys, thanks and have a great day. Thanks, Maha.
Thank you, Raj.
Bye for now.